This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305.
Microphone check 1 2 3 4. Mic check 1 2 3 4. Testing 1 2 3.
This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia.
Welcome, everybody, to the first meeting of the School Health Services Committee for 2025. We are so grateful to have you. First thing we're going to do is a roll call, please, ma'am.
Delegate Cohen. Here. Delegate McQuinn. Delegate Walker. Present. Delegate Cousins. Senator Peake. Here. Senator Pekarsky. Rebecca Bowers-Lanier. Dr. Michelle Boyd. Present. Angela Moore.
Present.
Tammy Bartlett. Dr. Gregory Hunley. Here. Superintendent Coons. Commissioner Shelton.
Here.
Delegate Cherry. Here. Senator Favola. You have a quorum, Mr. Chair.
Awesome. Thank you so much for that. Welcome, everyone who's come down to Richmond on this beautiful rainy day here in Richmond, Virginia, to come to this meeting. We're so grateful. Do not adjust your TV sets if you're watching online. I am not Senator Favola, who normally chairs this committee. We're missing her today, and I did want to acknowledge her probably virtually. And so if I mess this up, I'm sure I will get a text. Oh, I do see she's on there virtually. There it is. I had a feeling she was not going to be kept away, but we acknowledge you, ma'am, and we pray that you are doing well from your surgery recovery and that all is good down in your world.
Thank you. I'm doing well, and you're going to do a great job chairing the meeting. So thank you.
Awesome. So welcome to her. Now, since this is our first meeting of the year, what we'd like to do is just go around the horn and let everybody introduce themselves, tell who you are, where you're from, and what kind of role you play, why this is important to you, and what you're kind of looking forward to as we go through. I'll note that your microphone is your microphone to your right, and then after you speak, please turn it off because it only allows so many to be turned on before it stops. So there we go. We'll start from the end. Ms. Shelton.
Hello, I'm Dr. Karen Shelton, the State Health Commissioner with the Virginia Department of Health. Very invested in school health, and as a local health district director, work closely with our school superintendents and school nurses as they provided health in schools.
Hello, my name is Dr. Greg Hunley. I direct the Pauley Heart Center here at VCU in Richmond, Virginia. And my major interest, cardiovascular disease, kills a third of us. Risk factors really start in the education in the children and young adolescents and teenagers. And my interest is seeing to help redirect that and prevent cardiovascular disease.
Hello, good afternoon. My name is Angela Moore, and I am a nurse specialist in Chesterfield County Public Schools. I'm also the past president for the Virginia Association of School Nurses. We've been working for years to try to get a registered nurse in all schools in Virginia. That's really important to me and to our whole Virginia Association of School Nurses. I am nationally certified school nurse, and I'm also a certified developmental disabilities nurse. So I bring all of those to this committee, and hopefully we can work together to eventually get a registered nurse in all schools.
Good afternoon. My name is Michelle Boyd. I'm the Assistant Superintendent with Fairfax County Public Schools. I've served in student services for a number of years in multiple school divisions, and my passion is ensuring that students are well and have health services so they can access education on an ongoing and consistent basis.
Good afternoon. I'm Delegate Wendell Walker from the city of Lynchburg, 52nd District here. I serve on the Health Committee here in the General Assembly, and I really enjoyed that. I am trying to stay healthy, alive, and well so I can service the great constituents in my district and the citizens of the Commonwealth. Thank you.
Turn this mic on. There we go. Mark Peak, State Senate, also from Lynchburg, the 8th Senate District, and I serve on the Education and Health Committee in the Senate and on the K through 12 subcommittee. So a lot of these bills will come through my subcommittee, so I really look forward to working through these and balancing the safety and health of our K through 12 and making sure we don't keep piling on unfunded mandates on our school systems.
My least two favorite words, Senator. My name is Laura Jane Cohen. I get to represent HD 15, and apparently I'm representing the entire Democratic caucus on the House and Senate side, and all of Northern Virginia, so I'll take that very seriously today. I had the honor of getting to serve for 4 years on the Fairfax County School Board and get to serve now on the Education Committee, so really looking forward to all the wonderful things that this committee can do to help our students and our staff and our families.
Hi, I'm Becky Bowers Lanier. I am now in the role, playing the role of an advocacy consultant, but my background is in nursing. I have 2 degrees in nursing. I worked at Norfolk State University and Hampton University in nursing education for a number of years, then did nursing workforce policy work in Washington, D.C. for 8 years before moving here to become a lobbyist. My background in nursing is in mostly public health and nursing education, and I'm happy to be here.
Thank you for the introductions, and for those of you watching along at home, we're having some more of our members join us. And so we're going to give them just a moment to get settled, and then we'll let them introduce themselves. And Delegate McQuinn, are you ready to say hello to everyone? Or how about we go to Senator Favola, if we can get her up on the screen and let her say hello and introduce herself and where she's from and who she represents.
Can you see me? I think I'm on the screen.
Yes, ma'am, we've got you.
Thank you. Good afternoon. Thank you, Delegate Cherry, for chairing the meeting on my behalf. I represent Arlington County. It's Senate District 40. I chair the Rehabilitation and Social Services Committee. I serve on the Ed and Health Committee in the Senate and chair that Health Subcommittee. And I also serve on Finance and Appropriations Committee. Our Health Services Committee does very important work, and I am very proud of the collaborative way all of our stakeholders and members of the committee have helped shape our agenda and are willing to work together to see some progress.
Awesome. Please.
Hello, everyone. I'm Delegate Ray Cousins. I represent the 79th District, which is here in the city of Richmond. So thankfully, I didn't have to travel far, but somehow I was still late.
Thank you all so much. I do want to acknowledge our staff that work so hard to make us look good and all the work that they do. Ryan Brimmer and his team. Thank you for everything you do. With that, takes us through our agenda item number 1, and now on to agenda item number 2, which is a review of the 2025 regular legislative and budgetary proposals. Ryan.
Thank you, Mr. Chairman and members of the committee. Good to be with you again. I just wanted to quickly report that it was a very successful session for this committee. 4 of your endorsed proposals made it through, 3 statutory and 1 budgetary. So I've included copies of all those in your folders for you to review. And just very briefly, I'll walk through them as a reminder. So first in there is a proposal brought forward by Senator Pekarsky and Delegate Bennett Parker. This passed the General Assembly and was signed into law. So this new law is going to permit school boards to adopt policies to permit certain trained school employees to administer seizure rescue medications to students in need when the school nurse or another healthcare professional in the school is not able to reach that student in time. And then it will also permit secondary school students to self-possess these medications if that is indicated in the student's seizure management and action plan. The second statutory proposal that you endorsed and that passed both chambers and was signed into law was brought forward by Senator Rouse. Delegate Askew also carried an identical version in the House. This new law is going to require each public elementary and secondary school to establish a cardiac emergency response plan or an athletic emergency action plan for responding to incidents of sudden cardiac arrest in schools and in athletic competitions, and it sets forth several provisions that those plans would have to include. On the budgetary side, you endorsed a proposal that made it into the final budget that's now effective, which is item 271E4. That's in your packet in the highlighted language. And if you remember, this was to set aside $300,000 from the existing nursing scholarship fund to provide scholarships of up to $10,000 for school nurses who are LPNs to pursue training and education, to become RNs, and to continue to work as school nurses for a period of time, as long as the period in which they received that additional education to become an RN. Last but not least, Mr. Chairman, you did endorse a proposal to extend the sunset of this committee for an additional 3 years. That passed and has been signed into law, will go into effect on July 1st. So you'll now have through 2028 to continue the work that you do here in this committee. So just wanted to congratulate you. The voice of this committee obviously carries a lot of weight in the General Assembly, and I'd be happy to answer any questions that you may have about any of those bills or budget items.
Thank you, Ryan. Does anyone have any questions of Ryan about any of the bills that passed or any of the legislation? All right. Seeing none, we will go on to item 3, which is a review of the 2025 work plan. And Ryan, that will be you as well.
Yeah, thank you, Mr. Chairman. Senator Favola had just asked me to highlight some of the topics that you all have brought up and discussed in the past as items that you would like to look at moving forward. So I've included those on the agenda. There have been requests to review school-based mental health services. That could take various forms, but certainly something that we could look at in the future from various different lenses. Of course, we have the perennial topic of, mentioned by Ms. Moore already, of an expansion strategy for getting a registered nurse in every public school in the Commonwealth. Obviously chipped away at that a little bit with the budgetary item that I just mentioned. And then if there are any other items that you would like to add to our work plan, I know Senator Favola is certainly open to that as well. I saved Senate Bill 1303 for last. We'll give you a brief history of the procedure on this bill. So Senator McPike introduced Senate Bill 1303 in the 2025 regular session. This bill deals with the care of students diagnosed with diabetes in the public schools in the Commonwealth. The bill passed the Senate. He did introduce a fairly substantial substitute in the House Committee on Education to address some concerns from stakeholders on various sides of the issue. That committee had a lengthy hearing on that substitute, and instead of moving forward on that substitute, decided to introduce its own substitute to have this committee conduct a comprehensive review of the provisions of that bill over the course of this interim, and then come up with a recommendation for moving forward on the topic of diabetes medical management in schools. So that bill is now before this committee, and so that's something that will have to be on the work plan for this summer. You're legislatively mandated to review that bill. We'll be working with the patron to make sure that he has an opportunity to come before the committee at least once this summer and fall. And so those are kind of the big items that I have, Mr. Chairman. I'll turn it back over to you in case there's anything I missed or anything that anyone would like to add to the list that we have so far.
Thank you, Ryan. And in continuing conversation with Senate Bill 1303, the chairwoman, Senator Favola, is decided to do a subcommittee for this bill. The weight of this bill, the size of this bill, the magnitude of everything this bill is going to potentially be. She's asked myself and Senator Pekarsky to co-chair that subcommittee. And so if there's anyone else on this committee that would like to be a part of that, please either let her know or let me know so that we can figure out the pieces and parts. The goal is not to have everybody on it, but certainly there are some of us within the confines of this group that have specific points and skills that are going to be beneficial to that. And we'll be working that subcommittee outside of our normal meeting schedule, or maybe in conjunction with our normal meeting schedule as Senator Pekarsky is available. I have a little bit more flexibility than she does. And so we're going to try to do those. I did speak with Senator McPike yesterday to make sure that he knew what we were doing and where we were going. He's completely fine with that, thinks it's a great idea. He wants to do as much as we can in person for this because, again, I think robust discussions happen better when we're all in the same room together, vice maybe through a screen sometimes. And so that's the plan moving forward with 1303 is we will be studying that with that subcommittee and more information to follow as we get meetings scheduled. And again, if there's any of you that specifically want to really be a part of that, please let me or Senator Favola know so that we can make sure we get all the logistics done on that. Any other questions that you have or items that you may want to add to the member requested items? Delegate McQuinn. It's the button right at the base of your microphone that gives you the green light.
Okay. All right. Is it anything in terms of the bill 1303? Will this be, I guess, similar in nature to some other childhood disease or that children are dealing with in school? Because I know things like asthma and some other childhood, the challenges the young people have, that there are some, I guess, legislation that's already in place to help address that. So I guess that would be similar in nature, so you won't have to maybe reinvent the wheel where it comes to looking at this.
Yes, ma'am. And some parts of that will be transferable, but diabetes being the disease that it is, there are certain things that just aren't. And that's where this bill kind of got bogged down, was the idea that who's going to do what when in terms of the medical devices and making sure the monitoring is in place. And it gets even more dangerous than some of the other diseases, and hence why the nature of the bill to begin with and why we're going to study it in the sub to make sure that we get all those right. But great question. Thank you, Delegate. Any others?
I would just like to ask that I be on that committee, since I do work in the schools. And also just moving forward, whenever we do look into any of these different, bills, if we could just also include early childhood into those, because some of the ones, I'm not sure if we've changed them yet, but like EpiPens and some of them did not include early childhood. So I think that if they haven't been updated already, that we do need to update those to include early childhood facilities.
Ryan, if it's okay, I'll ask you to add that to our member requested items of a check to see that we're including early childhood when we're doing school age as well.
So in light of what I just heard here, so this may go beyond the scope of this bill here as diabetes was one of the issues. So are we opening up for other child care physical needs and things like that? Is that what I have heard, since you were indicating you want to be on the committee and you're more experienced?
I feel like I could be a crucial part of, somebody else. I could be crucial in helping you with the school piece for the diabetes DMMP, because it would be hard for you all to figure out what we're already doing in school, what's allowed and all of that without knowing what happens in the school facilities.
I think Senator Favola was going to jump in.
I was just going to say that the purpose of the subcommittee is really focused on Senate Bill 1303, not expanding beyond that to preschool. That is outside of the scope of the subcommittee. The General Assembly, as I understand it, wants us to come up with a pathway forward for meeting the intent of Senate Bill 1303, but something that is actually reasonably doable for the school systems and will address the issue that is intended to be addressed. So the subcommittee is really focused on Senate Bill 1303.
Doctor.
Delegate Carr, and Senator Favola, I'd be happy to offer my services. I mean, as a cardiologist, one of the primary risk factors for cardiovascular disease is diabetes, and we spend a large part of our time working on management strategies for that. So I'd be happy to volunteer for the subcommittee.
I think that's great. I do think we need school systems represented, so whether they're officially part of the committee or not, the School Board Association and the Association of Superintendents, they need to have a seat at the table, as well as those who have just offered to sit on the subcommittee.
Great point, Senator. Thank you. Does anyone else have any other comments or items that you would like to consider adding to our work plan for the year? Delegate Cohen.
Yes, I was hopeful that we might have an opportunity to kind of take a look at the state's role in the community schools model, particularly when we think about addressing mental and behavioral health. I think that every county kind of seems to do it differently, and even within counties, what a community school really means seems to be pretty varied. And so when we're talking about how to get more providers and deal with not just mental health, certainly it fits under there as well, but behavioral health, I wondered if we might have an opportunity to just kind of review what even lives in code about community schools.
Madam Chair, do you have an opinion about adding that to our work plan?
I think that's a great suggestion. More and more, the community school model keeps coming up in our discussions in front of our education subcommittee. So I would be very interested in sort of delving into all the various models and learning more about them. So I welcome that.
Anyone else from the committee have a comment? Moving on in our agenda today, there's an opportunity for public comment about either something that we've spoken about today or some other subject matter that may be relevant to this committee. Is there anyone in the audience that would like to provide a public comment? Please. Approach the lectern, introduce yourself, tell us who you are.
I'm Betsy Looney. Some of you might know me already. I'm president of the Virginia Association of School Nurses. And first of all, I want to thank you so much. When SB 1303 came up, there were a lot of concerns with the bill, and all we want to do is help the children and keep them as healthy and to do what we can do. And I met with a lot of you on this committee, and I just want to thank you for hearing our voices and for doing what you do, because I think it's important that we don't rush through certain bills, but that we fully understand the ramifications of them. And because ultimately, you're all here because you care about the students. I've been in school nursing for 26 years now. I've worked in both public and private school. I've been a school nurse supervisor. I'm on the Virginia School Health Committee with the American Academy of Pediatrics. And I'm on also other various committees. So it's really important to me. This is my passion. So I do want to thank you. And I know that Delegate Cohen brought up mental health. And I'm not sure if you're aware, but there's a mental health toolkit that came out for school nurses that was worked with the Virginia Academy of Pediatrics. And there's modules on there for learning and everything. And what you, being in the schools and what we learn is that mental health is a big issue. And an RN in a school is extraordinarily important because they not only do a lot with students with mental health and other issues. And also cardiac. It's so important, Dr. Hunley. I could not agree with you more about how raising children at the young age is so important for their health and cardiac and diabetes and all those things. So the other thing we did this year is we worked with the school board. I know some of you have brought up school members and school boards. Their major thing that they told me was teachers want to teach. They're not in the schools to deliver health care. They're not in the schools to do that. So they want to teach. That's what they were hired for, and all these mandates that we put on them and the training we put on them makes it extraordinarily difficult for them to do their job if there is not an RN in the school. So some of you might remember Congresswoman Jen Kiggins, who is now she's Congresswoman, but when she was here, she had brought up some bills about getting an RN in every school, and that was the premise of this committee. The School Health Committee was formed because of those bills that came up and the studies that were done and presented to you about the importance of having an RN, and that was the whole premise when this first committee was formed. So I appreciate you looking into that and taking the time and also offering the scholarships that you have for LPNs to become RNs. I do have a suggestion for a bill moving forward. I'll meet with Madam Favola or Delegate Cherry on it that I think would be beneficial that was just brought up to the federal Congress that was brought up, the Nurse Act. So in the meantime, I want to read something to you from the Virginia Academy of Pediatrics. They were not, Dr. Ramirez is helping them with this. They were not able to be here, but on this last committee meeting, one of the things that they would like to help with is getting an RN in every school. And this is a statement from them that they asked me to read. So it's from the Virginia Chapter Academy of Pediatrics, Nurse in Every School Statement. Virginia pediatricians strongly recommend a minimum of one full-time school nurse defined as a registered professional nurse present in every Virginia school. It has been demonstrated that having a school nurse present in school all day, every day, reduces chronic absenteeism, improves health, and increases safety for school-aged children. We currently have a deficit of adequate pediatric health care in Virginia. Approximately 25% of children have chronic illnesses, asthma, diabetes, and over 20% suffer from mental health and behavioral conditions. There is currently a child and adolescent mental health care shortage in every single county in Virginia. Additionally, childhood obesity has significantly increased in Virginia, putting children at substantial risk for long-term chronic disease. Access to health care is limited throughout the Commonwealth. In many regions of Virginia, particularly low-income and rural areas, the school nurse may be the only student's regular health care provider. A full-time nurse allows for timely recognition and treatment of physical and mental health needs, referral to appropriate resources, health care maintenance, and promotion of healthy living. Additionally, school nurses provide essential acute skilled care for students that help prevent unnecessary truancy, avoid emergency department visits, and decreases parents' time away from work. School nurses are not only crucial to better health care outcomes for the school-aged children of Virginia, but also decrease the financial burden of our system. Chronic disease management, early detection of behavioral and mental health issues, and obesity prevention are only a few of the ways nurses contribute to cost savings for Virginia. The Virginia chapter of the American Academy of Pediatrics recognizes the enormous physical and mental health benefits brought to the school-aged children of Virginia by the presence of a registered professional nurse in every school. And I want to say we, as Virginia Association of School Nurses, cannot thank them enough. That's a really big statement, huge, to have their backing and support. So I'm hoping that moving forward, this committee can find a way to make that happen. So thank you for your time, and thank you for all that you do.
Thank you for your comments. Anyone else? Introduce yourself. Hi, friend.
Hi. I'm Catherine Haynes, and I'm the Health Equity Manager for the Virginia Interfaith Center for Public Policy. And I keep showing up because I was a school board member, so shout out to Delegate Cohen. And I'll never forget that that was the first thing that people asked me during the pandemic was, does my school have a nurse? And I'm here today to propose a way to get there. But for some thoughts, how much time is lost when teachers have to be a substitute nurse? How much administrative time is lost in the front office when the staff has to care for a sick child? Recent legislation passed by the General Assembly will be implemented with fidelity only when there is an RN to oversee training implementation, and yet there is no funding dedicated from the state for an RN or an APRN in schools. The current lack of direct state support for RNs, APRNs in schools unintentionally, and I know this because I was on the school board, redirects funding towards instruction and away from health. We need both. To quote former Surgeon General Jocelyn Elders, you can't educate a child who isn't healthy, and you can't keep a child healthy who isn't educated. Licensed practical nurses are critical support, and we must support the LPN to RN pathway. So thank you so much for the $600,000 allocated in this past General Assembly. However, RNs have a legally broader scope of practice and can work independently to assess, plan, and implement patient care. APRNs are RNs who attain formal education to become autonomous providers. This means an RN can interpret medical records and write a plan of care for a health plan, an IEP or 504, but an LPN cannot. An RN can assess to determine that a headache or a stomach ache might be due to anxiety instead of a virus and make a referral to a counselor, but an LPN cannot. RNs are required to sign off on all Medicaid documentation for LPNs and clinic assistants and instructional assistants who are submitting claims. Funding is tight, and a recent study published in the Journal of the American Medical Association projected that the cost versus benefits of schools with an established school health program versus schools with no nursing services found $2.20 return on investment for every dollar spent. I am suggesting that we start in 2026 by adding RNs and APRNs to the list of approved expenditures for the at-risk add-on, and that we add a budget line item that is specifically for RNs and APRNs. In a time of expanding healthcare deserts, we need to make sure that our highest need districts, including rural areas, are able to meet the new requirements by the General Assembly. I'm confident that with this small adjustment, including APRNs and RNs and the at-risk add-on, possibly given tight funding, targeting community schools, which was mentioned today, or community schools and schools with existing clinics. And I'm going to pass out my comments if you're interested. And I also have the language from the at-risk add-on and a little one-pager from the HAC committee on the at-risk add-on. Thank you.
Thank you for sharing your comments today. Is there any other business to come before the committee today? Seeing none, I call us into adjournment. Have a great day. Thank you.
This is the Senate of Virginia, Richmond, Virginia.
For the committees, well, I guess they are going to keep us on. The subcommittee will report back to the main committee no later than October 1st. So that's our timeline for getting back to the full committee. And with that, we are adjourned.
All right.